Welcome to the Pop-Up Law series. In 2016, Indian states started banning e-cigarettes, with Punjab and Haryana being the first to ban them under the Poison Act. In a significant boost to promote preventive healthcare in 2019, the centre announced the ban on electric cigarettes. Still by then, 16 states had already banned these electronic devices since they were the new form of nicotine addiction, increasing rapidly even among non-smokers, especially youth, due to their attractive designs and added flavors. But unfortunately, the ban could not curb the menace of vaping, and a variety of nicotine delivery devices started being made available to people through several online shopping portals and even through WhatsApp groups. When the ban came into effect, the established industries like Juul and Vape withdrew, leaving a vacuum in the cigarette industry. This allowed cheap importers from other nations to enter the market, with inferior goods sold at astronomically low prices. According to the World Health Organization, around 27% of Indian population uses tobacco in some form or other, and India's massive population makes it the largest tobacco market in the world. India is one of the only countries that has completely banned the sale of e-cigarettes, yet the sale and availability of vaping devices are raising concern among parents and school teachers. The anti-vaping activists raised their concern about the poor enforcement of the ban on e-cigarettes. After 2 court cases were filed last year, the Health Ministry asked states to conduct month-long drives to implement the ban and submit reports. The first PIL was filed in Rajasthan in June 2022. A month later, the Jaipur police conducted raids and booked several people under the Prohibition of Electronic Cigarettes Production, Manufacture, Import, Export, Transport, Sale, Distribution, Storage and Advertisement Act 2019. On the other hand, the pro-vaping activists demanded to revoke the ban and urged to establish a better regulatory mechanism for vaping devices. Clinical investigations conducted worldwide demonstrate that vaping facilitates smoking cessation at a rate that is almost twice that of the conventional nicotine replacement therapies like gum and patches. Additionally, vaping has been linked to a decrease in combustible cigarette sales worldwide, making it a good substitute for those who intend to quit smoking. Once the health benefits were realized, several countries began reversing the bans or lifting the excess restrictions. However, India remains the only country with a complete ban, which has not worked correctly for the nation. It is challenging to regulate nicotine in India since it is available in some or other form. These electronic devices are readily available anywhere at meager prices, such as in regular pawn shops. With the formal players making e-cigarettes exit the market, the black market industry is gaining its foot all over, which with time will become impossible to control. Since the Indian population is overly dependent on tobacco, taking a progressive approach, the Indian government must review its stance on the e-cigarette vaping laws by ways of replacing the Prohibition of Electronic Cigarettes Act 2019 with well-thought-out legislation regulating the e-cigarette industry. Do let us know your views on this, and to learn more, please click the link below.